Hello guys, welcome back again. Okay, today we are going to talk about constipation. What is constipation? So I'm going to tell you what is constipation, the causes of constipation, and the remedies of constipation. So guys, don't scroll. So guys, a constipation is a process whereby the stool or the feces becomes hard to pass. During pooping, your stool becomes harder. You change your face while pooping. You change your face to a harder face. So that is constipation. So the causes of constipation may be due to diet. Maybe you are taking a different diet that you are used to take, or maybe you are taking food that does not have fibers, or the uptake of your water intake may lead to constipation. So maybe in a day you normally maybe take 1 glass of water, and then you take a food that does not have enough fiber in it. So the probability of having constipation is high. So in a day you're supposed to take at least 7 to 8 glasses of water. And then fibers, the example of fibers are maybe the wheat, the wheat corns, the what are other examples of fibers? Okay, I'll show you later during the video, but those are the examples of the food containing fibers. Or also you can take the kienyeji, the mbogas of kienyeji, the sucha, the saga, the kunde, and so on. Those mbogas are able to solidify your stool to prevent constipation. So let me take you through the features that define constipation. 1, your stool is hard. 2, the stool is dry. Another thing, you are feeling painful while passing stool. Painful while passing stool. Those are the features that define constipation. So guys, the situation of people that are likely to have constipation, that is natural, and it is not easily to be prevented. Maybe like pregnant women. Most of pregnant women are fond of constipation because of the pressure in the pelvic due to fetus, ending to the anus there. Yeah. Another class of people are old people. Old people are fond of constipating. Another people are women after giving birth. At the first week or the second week, they are fond of nini. Especially those women that have given birth with normal SVD. They have not undergone CS. Those ladies or women are fond of having constipation. So those are the class of people that are likely to have constipation. Yeah. And also people taking the kind of medication that can bring to constipation. So there are types of medications that brings up to constipation. So we have majorly 4 classes: old people, women during pregnancy, women after giving birth, and some of the medicines that can lead to constipation. So how does constipation happen? So constipation happens in colony, whereby the colony may absorb your water from the waste product. Then maybe you didn't take enough water, so the colony will end up absorbing that water, leaving the waste product dry, making it dry, thus making it difficult to pass during pooping. So those are the causes. Those are what? So those are the process of constipation during colony, whereby the colony, I've told you, it absorbs the water from the waste, leaving the waste dry and making it hard to poop. So the causes of constipation, we have anal impaction. This is due to the pile of stool in your anus or in your colon. We have anal fissure, and we have inflamed veins. So anal fissure, tear in the lining of your anus. We have inflamed veins, and we have fecal impaction. So those are the causes of constipation. So guys, I'm taking you through the procedure of preventing constipation, or during constipation, what you're supposed to do, especially maybe in babies. Sometimes babies do have constipation and you find it difficult to help them because you can't tell them to push. They're just there crying for help. Their stool is hard to push. They may end up bleeding, having anal bleeding. So I'm taking you through the process of preventing constipation or coming out of constipation. So guys, come up with me. Let us work together in this video. So guys, in this process, we are tapping the stomach, especially for babies who are undergoing constipation. This is the remedy of ending constipation. Use the right 2 fingers holding the stomach and the other 2 fingers tapping the 2 fingers holding the stomach. So make sure you tap at both sides of the stomach. During tapping, there is a sound being produced. I don't know the name of the sound, but you do. So guys, this is water, our first component or our first remedy. As you all know what is water and the importance of water in our body. Water plays a major part in our body, and it also plays a major part in constipation. So guys, another thing is water. Water is useful in constipation. Another one is Weetabix. Weetabix contains a lot of fiber, so it might aid in your constipation. It might help you, or it might prevent constipation. So water, Weetabix, they are sort of remedies of constipation. So as you can see, Weetabix has whole grain components. It is high in fiber, so the fibers may help you. And it also has ions and vitamins, so it might help you in another way, and it might prevent constipation in you. So guys, let us practice these things, especially in babies. Give them Weetabix at least once in a week. Give them water and then give them Weetabix. Another remedy is glycerin. Glycerin is also useful in constipation. You might apply it in your anal part, maybe especially in babies. Maybe if you feel your baby has a constipation, apply glycerin at the anal part of him or her. Apply as much as you can, maybe 5 drops or 7 drops, and then you leave it there. Your baby might end up pooing later, not immediate. It's not an immediate remedy, but it might be useful to you or the baby. So guys, as I shown you earlier, So far we have 3 remedies that I've shown you: water, glycerin, and Weetabix. It's a cornflakes, high in fiber, whole grain, contains vitamins, and it also has iron. So it has a high percentage of components in it. So another thing, it's a medication thing. It's called lactulose. Lactulose is a medicine that aids in constipation. It is not highly recommended, but it can be recommended maybe if the constipation does not comes to an end. So we have a lactulose calling Lagsulac, 10 grams. Yeah, it's now visible. You can see it. Sorry for the inconvenience of the video, but yes, you can see it again. Lactulose solution. I think for medication, this is the last remedy that you can go after maybe trying the ones that I've shown you. Maybe they have not worked, so you might end up be given medication. They might give you Lagsulac. There is another medicine called microenema, and there are other types of medicine that can end up loosening your stool. So for now, or for babies, we normally use this one, Lagsulac. It's very effective, but the doctors does not recommend you to use these ones. So far, the doctors maybe recommend you to use fruits like banana. Banana is the most effective fruit that can be used to prevent constipation. Yeah. Water, Weetabix, glycerin, and Lagsulac, lactose solution. So guys, this marks the end of our lesson today about constipation. I think one has learned something from it, especially mothers. As you can see, I'm trying to prevent constipation by giving the babies fruits. But the fruit they are taking is mango. But the most important fruit for constipation is banana. But fruits commonly plays a major part in also baby's body. So guys, let us follow let it be a routine. Follow those steps, but especially preventive is a very important thing than cure. So guys, let us prevent constipation by taking a lot of water, by taking a lot of food that contain fibers, and taking everything that I've shown you. Let us prevent it. But if it has come, let us cure it through those process that I've told you. Let us meet in another video. Bye bye. Hope I've helped someone.